The KwaZulu-Natal Health Department is going on a massive drive to encourage and boost vaccinations in rural areas. For more, we cross to our reporter Vusi Khumalo, who is in Nquthu, in the Northern KwaZulu-Natal. Vusi, thank you so much for your time. Tell us a little bit more about what's happening on your side.
Yes, we are currently at Nquthu, that's a municipality that is under Umzinyathi district. Well, we're told that as from the 1st of June to the 13th of June, so far the whole district of Umzinyathi has recorded 133 new infections of COVID-19. But with us is the MEC for Health in KwaZulu-Natal, Nquthu Zulu, here just to encourage a number of people because as previously reported that this area suffers, a backlog, or there's got a poor turnout of the elderly. Those are the people with over 60 years of age who should be at the vaccination sites. But you are told that the number is very, very poor, especially because there are some beliefs or perceptions surrounding the vaccination site, surrounding the vaccinations. But with us is the MEC who's going to tell us more details about also the program that are here just to encourage. They are also here to launch the program called COVID-19 Influencers Roadshow program. Just to tell us more, especially about your intention to visit this area of Nquthu in Northern KwaZulu-Natal, ma'am.
Thank you very much, and thank you for coming with us. As you correctly indicated, we are running a program that is a program of influencers in our society. What we have noted and noticed is that the majority of our uninsured community members are not coming up or are not pitching up to be vaccinated, and those are the people that you find in the rural areas and the people that you find in townships. So we then took a decision that as part of our campaign, let's ensure that we get people who will be able to motivate them, people who will be able to say to the people, let's go and vaccinate, because I've been vaccinated myself. So we identified a number of influential people in communities, and here we are talking about Amakosi in the rural areas in particular. We are talking about the leaders of the religious sector, because you know those that are religious would always listen to what their priests are saying to them. But we are also talking about the traditional healers, because we know that in the rural province, well, we know that in the province of KwaZulu-Natal in particular, that traditional healers are people that are taken very seriously, and it's important that we provide them with information, and it's important that they are also seen to be part of the campaign. So this campaign is a campaign we launched last week. You would remember that we went to Moses Mapita, where we had MEC Mshengo as a champion of eThekwini, together with Nquthu, and she was there to motivate people to come out. So in this particular district of Umzinyathi, we have Amakosi of Indawo, we have Abefundisi of the area, we also have the traditional healers with us.
Okay, who are these people? We mentioned that there are some celebrities as well as the healthcare professionals, and also some of the people who may be influencing the locals in order to ensure that they do go to the vaccination sites.
Well, it depends on the area. You know, as I was saying, at eThekwini we had the MEC and we also had Umamuqina, and we also had Abefundisi Bakona in the particular area. But in areas like these, we also look at what are the people of this particular area what do they believe in, and who do they believe are their leaders. That is why we then have the local deputy mayor with us. We have Amakosi Nquthu in particular. We have Abefundisi from Umzinyathi, because those are people in this area that they look up to. Those are people who are considered to be leaders in the society and in the community. And these are people that we have agreed with in today's meeting that when we go back, they will conduct, particularly Amakosi, they will conduct meetings and with their people, with the communities that they lead, and we will go there and address the concerns and the perceptions that the community seems to have. But we've also agreed with Abefundisi that we will be attending their church services, and in the church services we will address the concerns and the perceptions that our communities have, but we'll also bring the vaccinators with us. What we've done in the area of Umzinyathi in particular, while we have fixed vaccination sites, we also have outreach teams that actually go out to communities because of the vastness and the ruralness of the area and the poverty line. It's often not always possible for poor people to travel to town. So we go to them, and we have requested Amakosi, the councillors, to organize communities to be in halls, and then our outreach teams go there.
Okay, just briefly, I just want to get some of these beliefs that the community hinder them from visiting vaccination sites.
Look, when we started the year, there was a lot of noise about the 5G and the fact that COVID-19 is not really a sickness, it's something that comes from that 5G. In as much as we think we had dispelled that particular myth, but when you speak to the elderly, you realize that they still are harboring that notion that was spoken about back then. But in other areas, when they speak about the vaccine, it's often said that if you get vaccinated, then you are, particularly those that are religious, some of them will speak about it being a work of the devil, and if you get vaccinated, you are then inserting the devil in your body, and we need to deal with those myths, both from the level of the Department of Health, but from the level of the religious sector. There is quite a few other myths that are there, and it depends on where you are in the province, so we need to deal with them one by one.
Okay, thanks a lot.
Thank you very much.
That's the MEC for Health in KwaZulu-Natal saying that they are here to launch the program called Influencers Roadshow program in order to encourage people to visit the vaccination sites, and also ensuring that they do go there in their numbers, and also here to demystify some of the myths that are associated with vaccination here, especially at Nquthu, in rural parts of KwaZulu-Natal. With that said, it's back to you in the studio.
Thank you, Vusi.